For example, the patient is now confused. Patient cannot remember some stuff. Maybe the amount of time that the patient blacked out was really, really long. Those are things you will really worry about that. Okay, and then you need to be finding your way to the hospital.
Okay, so that means if a child just maybe falls off or has, bumps into something, and then after that pain, they're able to communicate, they're able to continue their normal play. Parents, you don't need to run up and down to try to get an x-ray, to try to do something to be sure that, oh, the head is okay, there's no problem.
The key thing is that if the patient is okay, it just depends on what you're seeing as a parent. Okay, if the patient is okay, no significant problems, maybe just a little headache, you watch the child. That's the key thing. You watch the child, or even the adult, watch the person. Anything of concern at all, you find your way to the hospital. It is in the hospital they will decide whether you need x-rays, whether you need that or need that. That's why those people are trained to do that.
It's not you as a parent or the individual that will start thinking, okay,
maybe you need an x-ray. No, absolutely not. Please, if we don't get anything from this talk at all, let it be that once there's a worry about something, this has happened and there's a worry, and that worry is out of your remit as a parent or as a family member and stuff, please start finding your way to the hospital. That's why the healthcare professionals are there to actually help you try and decipher what the issue is and whether it's something that's simple or something a little bit more complicated.
Okay, so let's get to the sinister headache.
Yeah, so
when do you say it is sinister headache?
So sinister headache, so like I was first of all talking about the persistence of the headaches. Something is persisting for a while, get worried. Headaches that are waking you up in the early hours of the morning, 2 a.m., 3 a.m., the headaches are waking you up. It's persistent, it's waking you up in the night. Be worried about such headaches. Headaches that tend to make you feel like vomiting, or you actually vomit. Although, remember, I said in the migraines, that you can actually have vomiting as well. Okay, but still, you as the individual having the headaches and maybe suspecting migraine, you're not the one that's going to make the diagnosis, say, oh, this is migraine. Still go to the hospital, still go to see a doctor. Okay, so headaches that are persisting, headaches that are waking you up in the wee hours of the morning, early hours of the morning, headaches that are making you feel like vomiting or vomiting, worrying. Headaches that are affecting your vision. I know I said in migraine, you can have photophobia where you don't like the lights. Okay, but headaches that is affecting your vision, blurred vision, double vision, please go see the doctor. Headaches that come on all of a sudden, bang, from nowhere. Headaches that come on all of a sudden, bang, where someone feels like someone use a stick or a baton and hit you at the back of the head. That's extremely worrying. Any headache that comes all of a sudden like that, you worry about a bleed in or around the brain.
Okay.
That's extremely important. So those kind of headaches, again, sometimes we call them thunderclap headaches from nowhere, pow. Okay, that's extremely, extremely important. Headaches that are associated with having convulsions. So it's having a headache and all of a sudden residents are having convulsions. Extremely worrying. Headaches that you have the headaches and then all of a sudden you start having symptoms that is suggesting that there's something else wrong in the brain. For example, weakness on one side, drooping of the face and stuff like that. Be worried. Okay. Now, what are the things? So what are some of the things that can cause sinister headaches? I've talked about one of them.
Yeah, let's look at
one of them. I'm talking about a bleed in the brain. Usually that one will be all of a sudden bang. You have the headaches coming. We call them sudden onset of headaches. Sudden onset of headaches. So you worry about a bleed, and there are different types of bleed. You can have a bleed in the brain. You can have a bleed around the brain. There are different compartments of the brain. Okay.
Then how dangerous and how life-threatening are these headaches when it has to be the thunderclap headache?
They are really life-threatening. Okay, like I said, there are different types of these bleeds, but one of them I'll talk about. What we call the subarachnoid hemorrhage, big medical term, but it just means a bleed around the brain. The arachnoid layer or subarachnoid layer is just around the brain, just that layer around the brain. Okay, and that brain houses the blood vessels that supply the brain. Okay, one of the commonest causes of a spontaneous or from nowhere bleed is what we call a brain aneurysm. A brain aneurysm is a weak spot on the blood vessel. Usually, predisposing factors are smoking and high blood pressure. Extremely so for those people who smoke or for those people who have high blood pressure and they are not seeing the doctor, taking their medication and getting it controlled, you are looking for trouble. Okay, almost 30% of patients who have this sort of bleed I talked about don't even make it to hospital.
Wow.
Yeah, they die on the spot. It's that bad. Okay, now some of the worrying things with this kind of headache is that a patient who has had this kind of bleed can rebleed again. A rebleed in this kind, specifically in this kind of subarachnoid hemorrhage I'm talking about, is fatal in 80% of patients.
Okay.
Fatal in 80% of patients. Okay. So like I said, this kind of sudden onset of headache, Very, very, especially when you have a sudden onset of a headache, patient passes out, has a seizure, or is not moving one side of the body and stuff, that has some sort of stroke. Extremely important. Okay.
Now, is it possible that if the person is rushed to a hospital, there can be, a revival of the patient? Can the patient be resuscitated?
Normally, that should be the plan. Okay. That should be,
Yeah.
but remember, Chichi, that we have a very weak healthcare
Health
system.
system, yeah.
Okay. That usually cannot cope, and then also there's the issue of financing and funding for healthcare. Okay. A significant number of Nigerians are poor. More than 100,000, 100 million of us are really poor. And the problem is that once a patient has run into trouble with these kind of problems, okay, the kind of care you need is really complex tertiary care, and it's extremely expensive, especially when you're getting to the point where this kind of patient is getting into critical care, or called intensive care.
Yeah.
Okay.
Now, most times, when things like this happen, or when this kind of headache occurs, the most likely place you find patients going to are the next general or district hospitals close to them,
or private hospital.
or private hospitals.
Yeah.
Sometimes they also go to, maybe if they have a healthcare center that is just around their neighborhood, and they just go there. Does it solve the problem, or would you recommend that when a patient has this kind of headache, they should go to somewhere? How do you judge where you will get that attention, so that you don't go to one district hospital, they start asking you questions, run tests, refer you to another hospital, and then this one refers you from specialist Gwagwalada teaching hospital to national hospital?
So Chichi, the aspect of care of this kind of patients that you're bringing up is extremely important, and thank you for asking this question. One of the things we talk about is the capacity of a healthcare facility to manage different types of problems. Okay, when someone has a bleeding, when a patient has a bleeding in the brain, that is already a tertiary level care issue.
Yeah.
Okay, tertiary. Now, your private hospital next to you, or your district hospital, or even most of your general hospitals, will not have the capacity to actually look after such a patient. There's a second critical issue as well. There's an adage, or that we say, that time is brain.
Yeah.
Every time you spend wasting time going to a private hospital, or a district hospital, or one general hospital that does not have the capacity, the outcome, the more you're tending towards a poor outcome for the patient in terms of significant disability or death. Okay, so the issue of the capacity of the hospital you're going to straight away when it happens is extremely important, and I will strongly advise that if this kind of thing happens, you go straight to a tertiary hospital.
Okay.
That's extremely. There are private hospitals that have the capacity, tertiary capacity. Okay, but by default, because I'm sure there are other people listening to this program who are outside Abuja. I can talk specifically about Abuja, where people can actually go, where I trust that if you go here, at least they have some level of capacity to actually go there. But for people who are outside Abuja, your default setting should be, once you have something that is seemingly sinister with respect to the suspicion of a bleed in the brain. Someone is just talking, all of a sudden the person just say, "Hey, my head, oh, headache." Person drops down, has a seizure, becomes unresponsive or something like that. Going to a private hospital, general hospital, and stuff like next to your number will not help. And in fact, you're putting the patient in bigger trouble, because every time you waste going to that private hospital, you are tending towards a poor outcome in terms of disability or death for the patient. Extremely important issue.
All right. Now, you also mentioned about headaches that are associated with high blood pressure being part of the sinister headaches. Now, we have a lot of people who are not even aware that they are hypertensive in the first place. So even when they have a headache, may not even be able to attribute the headache to, hypertensive headache or a sinister headache. They just feel, oh, okay, I've been having this headache. It's been on and on. I don't know how to go about it. I've taken one analgesic or the other.
Self-medication.
What happens?
Yeah. So I think key thing, going back to when I was talking about the simple headaches, and even now coming to the sinister headaches, anything, especially if your headaches are persisting and stuff, just go see a doctor. Okay? It is the doctor that is not going to analyze things. That's another thing. Healthcare professionals, they are like detectives. They are the ones that will listen to you, talk to you, do some examinations, think of whether you need to do extra tests, and they are the ones that will be able to tease out your blood pressure is really high. Okay? One of the things I tell people is that once you hit 40, even 35,
Yeah.
That issue of every 6 months or to a year going and doing that your general blood test, doing your general checkup and stuff like is extremely important. Okay, prevention, as they say, is better than cure. In a country like ours, where the funding for healthcare is very weak, okay, our primary healthcare systems is not working, which is supposed to be the bedrock, okay?
Yeah.
That issue of people being proactive about their health in terms of actually trying to prevent things before they happen is extremely important. Let me give you a story. There's a gentleman that I looked after recently who is 65 years old, had a bleed in the head, okay, because he has high blood pressure and they didn't detect it before then. And that man spent almost about 10 to 11 million naira. In fact, they've still not been able to pay for that. Now, guess what? If that 65-year-old man, he was attending, going to see his general practitioner, his family doctor, every 6 months or every 1 year, they would have detected that he actually has high blood pressure. And then the amount of money he would have used to buy antihypertensive, which are the blood pressure pills,
Yeah.
will definitely not be anywhere near 11 million
Yeah.
that he spent. Okay, with the hit on the family finances, significant hit. And so this issue of us talking about headaches and all this advocacy and say, hey, people, when you have a problem, please go to the hospital. In fact, be proactive. Once you get to between 35 and 40, go to the hospital, get your checks. They'll do all the checks, blood tests, you check whether your blood sugar, whether you're diabetic. They'll definitely check your blood pressure. Every time anybody goes to the hospital, they check your blood pressure. Okay, so that's extremely important.
Okay, now we're actually talking about headache, but sorry, I'm still taking you around issues concerning hypertension, because it seems like this is one of the most common ailments that we have, and yet it's still termed a silent killer because a lot of people take it for granted. Now, I've seen people who have, constant or their blood pressure runs within the range of 130, 140, 150 at intervals, and maybe now slashes down to 120. And there are some people who I see and they say, I don't want to take hypertensive drugs. Sometimes alternative medicine, maybe, lifestyle changes, take fruits, juices, this, that. What do you have to say on this?
It's just simple. Whatever treatment you want to have, alternative medicine, use diet, fruits, or whatever, you still need to be seeing a healthcare provider who is monitoring you. And in fact, guess what? You can even monitor yourself as well. Okay, there's this blood pressure machines that you have where you can monitor yourself every day and stuff like that. But still, at some point, see a healthcare provider who will actually still monitor things, okay, and actually check for other things as well. Because apart from the fact that high blood pressure can cause problems in the brain, it can cause problems in other organs as well. Your eyes, your kidneys. There are people who have actually lost the function of their kidneys and are looking to have kidney transplants, and it's actually due to the high blood pressure that's really damaged. So it's not just the brain.
All right, that's quite serious. Well, these are some of the issues that we're talking about, trying to bring issues concerning headaches and get you informed, when you have that headache, when you should start worrying, when you should take necessary action, what kind of action should you take. And I still have with me in the studio Dr. Douglas Emeka Okor. He's a consultant neurosurgeon at the Federal Medical Center Abuja. He's also a Nigerian health sector reform advocate. Now, this program is audience participatory, so it means that you can actually call to get to ask questions. Perhaps you think you're going through this experience, or there are some things you think you want to understand, some questions you want to ask concerning headaches. The number you can call to join the conversation this afternoon is 0806 396 3643. 0806 396 3643. So that's the number you can actually get to call to get to ask your questions, whatever it is. You want to share your experience with us, or you need an advice from the doctor on what you need to do. So the number once again is 0806 396 3643. Now, doctor, while we are waiting for the calls to come in, is it possible to prevent headaches, especially the sinister headaches? Is there a prevention, or it just occurs when it occurs?
Okay, so sinister headaches, there are still other stuff in terms of sinister headaches, in terms of cause of sinister headaches. We've talked about the bleeds in the brain.
Okay.
And we've said very clearly that things like hypertension
can be exposed
to the bleeds in the brain. But there are other things that can happen in the brain as well. Infection, tuberculosis, bacterial infection and stuff. You can have a brain abscess.
Wow.
Yeah, those things can cause. So anything that takes space in the brain, because the key thing is that the skull itself, which is the bone, is fixed volume. It's not going to change. Okay, so if you not add anything apart from the brain, the blood, the brain fluid that's in the brain, if you add something else to it, for example, you now have an abscess coming there, you have a brain tumor coming there. Okay, that pressure that's inside the brain will cause headaches.
Yeah.
Okay, anything that also causes a situation where the fluid within the brain starts to accumulate, because we all have fluid, all have water in our brain.
There's water in the brain.
There's water in the brain, okay? And that water is produced and it circulates around the brain and gets reabsorbed. So it's constantly produced and constantly taken out, okay? Anything that will cause the flow of the fluid to get blocked, okay, or the absorption of the fluid to cease or to reduce will cause the accumulation of fluid. We call that hydrocephalus. Hydro is water, cephalus is brain. So water in the brain. Okay. So
is that why we have some babies that are born with very
big head? Oh yeah, there you go. We call it hydrocephalus. Okay.
Yeah.
But it can actually happen in adults as well, because as anything that, for example, if you have a brain tumor in the base of the brain, pushing and blocking the channel through which the fluid flows through, and the fluid cannot flow through anymore, the fluid will accumulate. Okay. So fluid accumulation in the brain can cause headaches. A brain tumor anywhere in the brain can cause headaches. Blood anywhere in the brain, either acute blood or blood that's come from a bleed like that, can cause that as well. Also, especially the elderly patients. In elderly patients, just a simple trauma to the head, for example, maybe someone getting out of the car and you hit your head at the top of where the door closes and stuff like that. Just that kind of mild amount of trauma, okay, can cause a situation where, because as we all grow older, the brain shrinks a little bit, and there are blood vessels connecting the surface of the brain to the under surface of the membrane that covers the brain. And because of the shrinking of the brain, those blood vessels are now stretched a little bit. So just a little bit of trauma, the blood vessel tears, and there's a little bit of blood that bleeds into that space. We call it the subdural space. Okay, but over time, that amount of blood can serve as an osmotic, solute or whatever, and then now attract more water more water into that area where the blood is, and the blood now becomes old blood, but that takes up space and now starts pressing on the brain. We call it a chronic subdural hematoma. The dura is the membrane that covers the brain. So that blood clot under the membrane, but over the brain, pressing the brain. And in fact, guess what? I just operated on somebody who actually had that problem 2 days ago. Okay, so we call it the subdural hematoma. That will cause headaches as well because of this pressure within the skull. Anything that causes pressure within the skull, okay, will cause headaches.
Now, the interesting thing is that a lot of times people have these headaches and fail to realize that they could actually be life-threatening and they could be caused by very serious situation. For instance, what you talked about, someone hitting his head, at the up part of the car, you may not think is as dangerous as it can be, but it results into that. Now, let's look at treatment of these kind of headaches. What are the treatments that are available? Okay, so the first thing is we're talking about simple headaches. Okay, any sort of symptoms that are going with other tension headache, the migraines, the cluster headaches, the sinusitis that I talked about. Okay, see a doctor. Okay, it might be a family, a general practitioner or a family medicine doctor or whatever. Okay, like I said, tension headaches are the most common headaches. Okay, so what's the treatment for tension headaches? Painkillers when you need them, rest, sleeping well. Okay, because the opposite is what will cause the tension. The fact that there's stress, there's a lack of sleep and all that. Your work being very stressful and stuff like that. Or people who maybe have just been bereaved, or there's sort of stresses within your family and stuff like that. Okay, migraines. Okay. Usually migraines will be treated by the headache specialist, the neurologist. In fact, let me try and do. So I'm a neurosurgeon. So what's the difference? Exactly. So a neurosurgeon looks after patients that have medical conditions that affect their brain, their spinal cord, the spine. Spinal cord and spine are different. The nerves that supply the rest of the body, and they do operations. So you actually do brain and spine operations. Okay. So that's what I do. I'm a neurosurgeon. While a neurologist will look after patients who also have brain, spinal cord, nerve problems, but they do not do operations. They give drugs most of the time. Yeah. Okay. So that's different between a neurologist and the neurosurgeon. So for migraines, that's the forte of the neurologist. Okay.
Okay, so
Because he doesn't need to do any surgery in
yeah, so
this
it will be
regard.
mainly just drugs and maybe lifestyle modification and maybe depending on what they eat,
Yeah.
what the patient eats and stuff. Cluster headaches as well. The one I talked about where there's pain around the eye, redness, tearing of the eye and stuff like that. Also, neurologists will actually look after such patients, usually to be pain medication and stuff like that. Sinusitis. Remember I talked about the sinusitis?
Yeah,
I talked
yeah.
about these spaces behind the nose, around and behind the nose, called the sinuses, and then you can have inflammation, some sort of stuffy nose, and nasal congestion and stuff like that.
Yeah.
Usually, the family medicine or the general practitioners can start maybe antibiotics, painkillers, nasal decongestants, and stuff like that. But if there are any worries, then they go to the ear, nose, and throat doctors.
Yeah.
Okay. You want with systemic or febrile illnesses, malaria and stuff like standard. Once you treat
The illness.
the illness and stuff,
the
headaches
will
should
go.
actually get better. The hormonal ones where you talk about the menstrual,
Yeah. The
so
drugs.
people having menstrual, that is mainly just going to be painkillers, and of
Okay.
course, seeing the gynecologist
Yeah,
to actually
yeah.
have a look at that as well. The post-traumatic headaches, especially if the patient doesn't have worrying symptoms like being confused or being drowsy and stuff like that,
Yeah.
it's mainly just going to be painkillers as well and rest. Okay.
Okay.
The spinal headaches, usually it settles, okay, and that one we're talking about the leak of the brain fluid
Yeah,
because
yeah.
of doing the epidurals and stuff like that. So for that one, usually it will stop on its own. If it doesn't stop and becomes a significant problem where once a patient sits up or stands up, they have these low pressure headaches and stuff, we might need to be getting to see the doctor, especially anesthetists that do what we call a blood patch. Okay, where they actually take blood and actually put some amount of blood around that area where the fluid is leaking, and that actually causes some inflammation and helps to heal up the area.
Okay.
Okay. The sinister headaches.
Yeah.
Generally, the first thing to do is to actually, how is the patient presenting first of all? If the patient is presenting as an emergency, the sudden onset of headaches, possibly combined with other things,
Yeah.
with features suggestive of like what we call meningitic features that look like if could this patient have meningitis, but having sudden onset of headaches, you're thinking could this be subarachnoid hemorrhage? If you have headaches where it's coming all of a sudden, you're having convulsions, the patient passes out and becomes unresponsive, unconscious, or it's you're having such headaches and the patient is losing the function on one side, not able to speak and stuff, i.e. a stroke, okay?
Yeah.
All those sound like an emergencies. You are going straight to a tertiary facility that most people will have the capacity to actually, first of all, stabilize and resuscitate the patient, because that's the first thing. Stabilize and resuscitate the patient, and then start thinking of, okay, let's get a scan to actually know exactly what we're dealing with. Okay?
Yeah.
And just to say this, once a patient is in trouble acutely, or when the patient has an emergency problem like that, it is a CT scan that's the best thing to do.
Okay.
A CT scan. There are different types of brain scans, but a CT scan is the best thing to do in such a situation. Okay.
Yeah.
Remember that I said there are other patients that can have headaches that is pointing towards, oh, this could be sinister. Okay.
Yeah.
Brain tumor, having infection in the brain.
Yeah.
Okay. Having hydrocephalus. Those are worrying things as well. So same thing. Going to a hospital, a doctor, a healthcare provider assessing the patient, and if they have any suspicions about, oh, what could this be, referring. If they want, they can do, in such patients that are not presenting acutely as an emergency, they can do a CT scan as well, or probably an MRI. They can choose, okay? But if a doctor or healthcare professional is seeing such a patient, it will be good if they have the contact of a neurosurgeon or a neurologist to actually call, oh, I'm seeing such a patient, and these are the symptoms. What do you advise? Should I do a CT scan or an MRI scan? So that communication within healthcare providers will also help as well. And of course, once you make a diagnosis of, oh, it's either hydrocephalus, fluid in the brain from a tumor, or a brain tumor, or an abscess, or an infection, or anything, of course, the neurosurgeon or the neurologist, depending on who is looking at the patient, now does the needful.
All right, it's still Mother Care coming to you on Armed Forces Radio 107.7 FM Abuja, and the number to still call is 0806 396 3643. So we're ready to take your calls. You can call 0806 396 3643. You're also free to send a text message. Maybe you're not able to reach us via phone call. You can send a text message, and it's still the same number that you can send your text to 0806 396 3643. That's the number you can reach us on to get to ask your questions, whatever questions you think you have concerning headaches, or you can share your experiences. You can get to find out whatever it is that you want to know concerning headache. I still have with me in the studio Dr. Douglas Emeka Okor. He's a consultant neurosurgeon at the Federal Medical Center, Abuja. He's also a Nigerian health sector reform advocate. All right, still talking about this. Sometimes you find people that have headaches, and it's like identified with the pressure in the eyes. What happens when you have headaches that are associated with the eyes?
So usually, any sort of straining of the eyes can also cause headaches as well. Thank you for bringing that up. Any sort of straining with the eyes can also cause headaches. Okay, so sometimes if you're having difficulty maybe focusing and stuff like that, one of the things to do will be actually to go see the eye doctors or the eye specialist. Okay, sometimes it might just be that the glasses you're using and stuff is not the right one.
Yeah.
And sometimes just changing the glasses can actually help.
Okay.
Yeah.
Now, is it possible for someone to have, pressure in the eye and then the headaches become constant? Like 1 week, 2 weeks, the headache is still there, but maybe it's just associated with the eye, or it's something that just gives you a signal and then it stops? Or when there's this constant headache, can it also be associated, maybe a sinister headache associated with the eyes?
Sinister headache associated with the eyes. So the key thing is that the brain is connected with the eyes.
Yeah.
And basically, you can definitely have those headaches from exactly what we just talked about, where just because of the straining, okay, maybe the glasses you're using is not the right one for you, or and then you actually going to see the eye doctors and the eye specialists will actually help with that. You can actually have brain tumors that are actually affecting the nerve to the eye as well.
Okay.
Yeah, you can actually have that, but it's not very common. Okay, but the key thing here is that whenever someone is having any issues with the eyes, one of the things I always say is that if an eye specialist actually sees a patient and they cannot find any issue with the eye itself, they must always think about the brain.
Yeah.
Because the eye is connected to the brain. So the key thing, what all the eye specialists will usually do when someone is complaining about some eye issues, is that they will check the eye, okay, and hopefully, usually, they find what the problem is with the eye. If there's no problem with the eye at all, please, always think about this. This is to my colleagues now.
Yeah.
In the United, always think about the brain. That could there be something wrong with the brain? And I've seen a couple of patients like that. You understand? They have headaches or they have other symptoms with the eye. They go to see the eye doctor, and they're seeing eye doctors or eye specialists for 5 years, 10 years.
And there's no treatment.
Exactly. What they're changing glasses or giving eye drops and stuff like that, and the problem is actually in the brain. Okay, so that thing of having what we call a high index of suspicion is extremely important, especially when you're not finding anything significant in the eye to actually be able to explain the patient's symptoms or problem.
Wow, that's quite serious. All right, now let's also look at headaches and seizures. I'm thinking of how I want to put this.
You're wondering what's the relationship, or is there a relationship?
Is there a relationship with headaches and seizures? Can headaches just lead people into having seizures? And I also want you to, I don't know how you're going to relate it with probably a spread of cancers into the brain.
Okay, so key thing is this. Seizures, what are seizures? Convulsions, as we normally know them as seizures. Okay, anything that irritates the brain has a tendency to cause seizures.
Okay.
So if there's a brain tumor in or around the brain, it can irritate the brain. If there's infection in or around the brain, it can irritate the brain.
Yeah.
If there's an impact on the head, for example, there's a bruising of the brain, the fall, road traffic accident, someone hit you, and or during contact sport and stuff like that, and there's bruising of the brain.
The brain can be bruised.
Oh yeah, the brain can be bruised. Just the same thing. If someone hits your hand, you can be bruised, isn't it?
Yeah.
As well. So the same thing happens to the brain as well. If there's a bleed in or around the brain, it can irritate the brain. So all these things can cause seizures because there's an irritation of the brain. Now, remember we talked about headaches. What's one of the causes of headaches? Anything that will occupy space within that is not supposed to be there. Normally, within the skull, what you have is the brain, you have blood, and then you have the fluid around the brain, isn't it? If you add anything to it, maybe for example, the brain fluid becomes too much.
Yeah.
Whatever what I'm talking about, you add blood clot into it. you add a brain tumor into it, you add like a pus into it and stuff. That's taking space, isn't it?
Yeah.
That will cause headaches. So those things I've talked about can irritate the brain and cause seizures. But because they are taking space and putting pressure in the brain, they will cause headaches as well. So it's not as if the headaches is causing the seizure or the seizure is causing the headaches. Okay, it's just that one is being caused by the irritation of the brain, and the other is being caused because there's pressure within that box, that skull.
Wow. All right.
Sorry, you wanted me to relate it to something else. What was the other thing you wanted me to relate it to?
I wanted you to relate it to, having cancer spreads to the brain.
Okay, so key thing about, I'll call them tumors. Okay,
Yeah.
Tumors. There are two types of tumors. There are benign tumors that affect the brain. Benign tumors, which means they are not cancers.
Yeah.
Okay, and there are cancerous tumors.
Yeah.
Okay, under the cancerous tumors, you can have tumors that are coming from the brain itself. They are developing from the brain, and you can have tumors that are spreading from somewhere else to the brain. Okay, so we call it a metastatic tumor.
Yeah.
Okay,
Yeah.
so the common cancers that you have that can spread to the brain are breast cancer,
Okay.
lung cancer,
Yeah.
cancer affecting the bowels, colon cancer, and stuff like that.
Yeah.
Melanomas,
Yeah.
melanomas, these skin cancers, and then there's a last one, and spread from the kidneys, cancer of the kidney, what we call
Yeah.
renal cell carcinoma. Okay, those are the 5 common ones
Okay.
that
That can spread to the
through
brain.
the brain.
So sometimes when people also have, such pressure to the brain or seizures or things, it could also be traceable to maybe having cancers in one
That's
part of
one
the body.
of the possible causes. Yeah.
Wow. Now, let's look at lifestyle issues generally to prevent this. For people to live a healthy life, for people to be able to, avoid some of these things, what are some key things that an individual needs to do to take care of their brains, to take care of, their health, to take care of themselves in terms of headaches?
So the first one, remember I said the most common headaches are tension headaches, isn't it?
Yeah.
Yeah, stress headaches. That's the most common one. So first thing you do is, while I'm sure most people love their jobs and stuff like that, please find time to rest. Find time for leisure, extremely important.
Okay.
Find time to do things that you like, and find time to rest. There's a particular reason why we actually sleep well. Sleep, you understand, having a good amount of sleep, at least